Hi, Leslie Parent here with Piece by Piece Wellness Coaching. I'm your nurse, functional practitioner, and board certified health coach, bringing you Piece Bite number 13, why you just might not be ready to make the diet and lifestyle changes to help your chronic joint pain. Well, if you suffer from chronic joint pain, it can be really difficult to manage the pain on your own, especially if the desired outcome of reducing or eliminating the discomfort seems just too far away. But with the right mindset and the right support, it is possible to make those positive changes. You know, a helpful tool in this journey is really understanding what stage of change you really are in. And that tool that we can use is a theory of stages of change by Prochaska. In his theoretical model, the theory explains how people go through individual and different stages of change when trying to make those positive lifestyle changes. And understanding where you're at in the process can really empower you to take those actions in the ways that are most effective for you. So there's 6 stages to Prochaska's model, and they consist of the following. It is the pre-contemplation, contemplation, preparation, action, maintenance, and termination phases. And knowing which of those stages best reflects where you're at in your journey towards improved health and can help you recognize which strategies and approaches might work best for you. In the pre-contemplation stage, you may not even recognize that change is necessary. In this stage, you might have been diagnosed with a chronic joint condition, and you may be assuming either a victim role or potentially denying that you have a chronic joint condition or a number of things. Another example may be that you're a newly diagnosed arthritis or autoimmune disease patient, and you're just not aware that changes in diet and lifestyle can make a significant impact on your inflammation and pain experience. At any rate, in this stage, you really have no intent to make changes in your health. Possibly, you're not ready to make the changes because you can't take control over your health when you lack the knowledge or motivation to make the change. If you find yourself in the pre-contemplation stage, it might be helpful to start by raising your awareness of how joint pain is impacting your life. It is also important to remember that change does not happen overnight. The journey of reaching a healthier state will take time, effort, and patience. In the contemplation phase, people seriously begin to acknowledge the need for change within the next 6 months, and they start considering different options of how to go about it. Nevertheless, it can be 2 years where you stay in a contemplation phase, and this is where you might be exposed to information, resources, support from friends, Facebook groups, family information, or professionals who may try to motivate you to consider what changes might potentially help improve your chronic joint condition and your health outcomes. In this phase, you're seeking information, but you're still not ready to make the decision for changes in diet and lifestyle. In the preparation stage, this is where you start taking actionable steps towards making change, where maybe you're planning and goal setting and where that's really especially important. At this stage, you recognize a need for change and you're starting to take those small steps. In fact, you may have successfully or unsuccessfully tried to make some health changes in the recent past, but you're intending on moving forward to making positive change. Here is where a health coach can be extremely helpful in supporting an individual to develop realistic, actionable, and time-bound goals. If you're already moving into contemplation or preparation phases, hey, that's great. You have already taken an important step towards making positive changes for yourself. At this point, it might be beneficial to reach out for additional support. Talk with friends or family members, support group people about what's worked for them and managing their chronic joint pain. The action or implementation stage is when a plan has actually been put into place and goals have been set. This is often known as the doing stage and can take 1 to 6 months. This stage can be very frustrating because individuals vary in what triggers or root issues are underlying their chronic joint pain conditions, and it can take a great deal of effort, patience, and resilience to do the work on a plan and shift a plan where needed based on lab test results, response to medication, natural therapies, or changes in diet and lifestyle. Coaching can help support you to stay on track, consider and plan to address any barriers or opportunities to move forward with change. When you finally reach the maintenance phase, you are sustaining your hard work by continuing with your plan and reinforcing those healthy behaviors. This is where you're seeing the effects of successful completion of your plan and goals, but where it's also important to continue solidifying the new diet and lifestyle changes that are making a positive difference in your health. This is where you may be tempted to get sucked back into old health behaviors that can re-trigger inflammation and joint pain. Health coaching at more periodic individuals in this phase can help individuals gain perspective on where they have come from, what they've achieved, and the value of their efforts. The final stage, called the termination stage, marks successful completion of those diet and lifestyle changes that have become automatic and natural habits over time. Here is where the individual becomes very confident that they can successfully navigate any challenges and where they continue to invest in their health and take control of their diet and lifestyle to continue to live that healthy quality of life in face of their diagnosis with a chronic joint condition. This is an individual who's maximized control over their health and well-being. Ultimately, you are the best judge of how to move yourself into a stage of greater readiness for change that resonates most with you. By leveraging Prochaska's stages of change model and utilizing additional support when needed, positive lifestyle changes can become attainable and bring relief from chronic joint pain. As a health coach, it's important for me to understand what stage of change a client or potential client is in. This helps me with my coach approach as well as assessing whether an individual may be ready for one of my programs. If you'd like to learn more about whether you're ready for making changes to your health to manage a chronic joint condition, please feel free to schedule a free discovery call with me through the link in the video description below. I'm here to help you and wish the best in your health journey and give yourself credit that you do need to go through the stages of change. Take care.